Hello everyone, सत श्री अकाल, नमस्ते, वेलकम ऑल ऑन अचीवर्स। आज हम बात करेंगे नेक्स्ट जनरेशन क्वेश्चंस के बारे। सो व्हाट इज़ नेक्स्ट जनरेशन क्वेश्चंस Nclex. So today I write it down over here one question. So case study में mostly ये क्या करते हैं, ऐसे questions डाल के they're gonna complete 6 questions for the case study. So I'm trying to break down each question. So here is the one question we're gonna talk about today, this question, and this is very good question, and let's go through. The question is over here. The nurse reviewed the note for 86-year-old client admitted to sniff. Okay. So whenever you read the question, मैं हमेशा यही कहती हूँ, go 3 times. First, just go overview. Second, think about that, pick up the key points. And the third one, just trying to imagine the whole story in your brain, like what's going on, what nurse have to do, what you have to do for the patient. So over here, they are saying, okay, so nurse देख रही है एक note for 86-year-old client patient admitted to sniff. Sniff is skilled nursing facility. So they're gonna give you a question like that, the graph, and the nurse note over here, like health history of the patient, nurse note, vital sign or lab. But over here, they're showing up the nurse note. So the nurse note is mentioned over here. Transfer from hospital to sniff after TKA. Don't get confused. What is TKA? It's not like amputation of total knee or something. This is like a total knee arthroplasty, kind of total knee replacement. So patient coming to hospital, from hospital to sniff after TKA for PT and OT, daughter state that her mother has been confused at times since surgery, but no history of dementia. Needs supervision when transferred from bed to chair. Incontinent of urine at times. S. Able to feed self. Need assistance with bathing. Fell yesterday in the bathroom. Vital sign. Temperature 98 degree Fahrenheit. Heart rate 88. Respiration 18. Blood pressure 102/64. Right knee incision dry and intact with steri strips. Current artery inter 3, history of hypertension, transient ischemic stroke, TIA, stress incontinence, and osteoarthritis. So here is everything over here. And now they're asking, the nurse recognized that relevant clients finding that are immediate concern to nurse are, we have to find 1, 2, and 3 options. And they give us like option 1, 2, 3. So everything in front of us is kind of cheating, right? So they gave us everything over here. They told us we have to pick 3 answers from each option. And another cheating and key point for us is like immediate. We have to pick like what is the highest priority in these options. What nurse have to do first. So if you find out a patient not breathing and unconscious, what are we gonna do first? Our priority always like check the pulse, not start the CPR, right? Check the pulse is priority. The same thing we're gonna find it out, like what is the first step nurse have to do, the first thing nurse have to follow up. So go through now question second time. Okay, so the 86-year-old patient come to sniff after TKA for PT and OT, right? Okay, she's here after TKA for PT and OT, like for physical therapy, occupational therapy. So daughter state that her mother has been confused at times in surgery. So key point, she is confused at the time since surgery, right? But no history of dementia. So she didn't diagnose yet for dementia. Because dementia patients are always on high risk of fall. And what is our priority? Patient safety, always in your mind. So needs supervision when transferring from bed to chair. Okay, all right. Incontinent of urine at times. Okay, S, incontinent, right? Okay, We pick up this one too. Able to feed self but need assistant with bathing. All right. Fell yesterday. Very good key point. Patient safety. Vital signs. Beautiful. We have to go through vital sign, temperature 98. Sorry for that. Okay. So it's beautiful. Heart rate 88. Perfect. Respiration 18. Beautiful. What we need. Everything is stable. 18. We don't have to worry about until it's below 12. So blood pressure 102/64. Do we have to think about that? What do you think? I believe, yeah. 102/64. So age is 86. After surgery, 102/64. Okay, we'll think about that later. Right knee incision, dry, intact with steri strips. Beautiful. Steri strips are there. Wound is intact. What we need though, if in case steri strips come out, we can put that just later on. Just a sticky tapes. Just put it back. Current alert entered 3. Bingo is fine too. Alert entered 4 and then 3 common is fine. History. Okay, we have to pay attention on this. History of hypertension. Okay, hypertension. Maybe the patient taking medication and the medication always drop the blood pressure. So patient on the risk of fall. Okay. Transient ischemic stroke, TIA. Okay, but right now, did they mention any symptom over here related to TIA? Any one side weakness and anything? Yeah, it's confusion over here, but they didn't clarify any sign and symptom related to stroke. Nothing. This is just a tiny stroke history. Okay. Stress incontinence. Wow. Okay. Patient had a diagnosis for stress incontinence means whenever the stress gonna come into the patient life, surgery is always a kind of stress. So now, right now, patient is under stress because she or he, it's a she, sorry, she had a surgery, right? So definitely she's under the stress. So that gonna cause incontinence, and also in the old age, or either doesn't matter what age, changing our surrounding environment area, especially in kids and old age, is always cause stress because they are not in their comfort zone. And the history of osteoarthritis. That's why she went for TKA. It was affecting her knee. So she had a knee replacement. So we picked up the points over here. Patient here after surgery. She's confused since surgery. She's incontinent. Okay. Fell yesterday. This is the most important point. Patient safety. And the vitals over here, everything is normal except blood pressure. Okay. History. I didn't see anything, stressful over here. She just had a history, but right now, nothing concerning related to this history. Okay, so right now we have the key points, and think about that in your brain. So always go 3 times, go through the question. So we already read what's over here. We pick up the already key points, and now we're gonna imagine old age lady. You have a patient, and she's here after surgery, and definitely she had her mobility and ability to ambulate is affected, right? So she can ambulate properly like she used to, and she's on high risk of fall because she's confused, she's incontinent, and she already had a fall. So her blood pressure is not really good. Maybe she's on orthostatic hypotension or something, and we have to definitely assess patient for that. And these points we have it. And what we are trying to prevent fall, because fall is a major issue everywhere. Even though the patient into the hospital, even though patient into the SNF, fall is go always to the state. We have to document everything. We have to inform every single fall to the state. Even though if the patient got any injury, अगर उसको injury हो गई fall से related, especially if any fracture or something, then we are in trouble. So the family can sue to the facility, right? Even though it's a simple fall, and if the patient got fractured, then definitely the state gonna come and ask the question to us. So always prevent the fall. Patient safety is our priority everywhere. So they telling us now, based on this finding, nurse recognize that relevant clients finding that are immediate, right? They made us easy for us, right? Now we have to just focus on the priority things over here are concerned to the nurse, and they give us option like 1, 2 and 3. It's kind of cheating. हम इसमें cheating कर सकते हैं, right? Because we have everything over here, and हमें क्या देखना है? We have key point. We already pick it up. Now we have to focus on like what is our priority, and we have to pick only 3. अगर आपको कोई क्वेश्चन आ जाए, अगर जैसे मल्टीपल चॉइस होते हैं, उसमें होता है हमें पता नहीं होता कि 4 पिक करने हैं, 5 पिक करने हैं. यहाँ पे तो उन्होंने बहुत ईजी कर दिया कि फोकस ऑन प्रायोरिटी थिंग्स एंड जस्ट पिक इट अप 3 थिंग्स फ्रॉम दीज ऑप्शंस. लग रहा है ना जैसे कि वो एग्ज़ाम में बोलते होते हैं कि आपको पर्ची दे दी कि ओके चीटिंग करो इससे. सो दिस इज़ द सेम थिंग ओवर हियर. सो लेट्स गो प्ले ओवर हियर नाउ. ऑप्शंस, वी हैव ऑप्शंस. pick up 3, 1, 2, 3. Sometime ऐसे भी हो सकता है इसमें 2 हों इसमें, but right now it's looking like 1 from here, 1 from here, 1 from here. So okay, let's go play true and false. Respiration 18. Do we have to worry about that? Is that a concern? No, just false. Okay, go. Okay, let's go heart rate 88. Fine, come on. Maybe the patient in pain or something is still normal. Fine, ignore that. We need a priority, right? Most important in these 3, right? I'm sorry. So 1 or 2 by 64. What do you think? Is that good blood pressure? Nah, because patient may be risk on orthostatic hypotension. Why? Because patient had already surgery. Patient may be on pain medication. Patient is hypertension too, because hypertension medication always cause low blood pressure, high risk of orthostatic blood pressure, fall drop, and then stress is surgery over here. And the third thing is the age. So that we have so many factors that can cause orthostatic hypotension. So what do you think? True or false? Definitely true. Okay, we got this one over here, right? So we have like blood pressure. Sorry, my handwriting. 102 by 64. Okay, we are done with first option. Good job. Let's go. Option 2. We have picked it up over here. Like, what is the priority over here? Okay. Confused at the time since surgery. Okay. All right. History of TIA. Stroke. Do you think they give us any sign and symptom related to TIA? We have to concern and assess further the patient. Maybe it's a confusion over here. All right. Maybe TIA, any ischemic stroke or any like bleeding in the brain causing the patient confused. Maybe the patient fell down yesterday. Maybe that one causing confusion or something. But they didn't give us further symptoms over here. So, okay, keep this at the side too. Admitted for PTOT after TKA. True or false? Do we have to think about that? No, patient already here for therapy. Just cancel. Okay, now these 2. Okay, we need immediate. I know we are confusing these 2 now, but we need immediate priority. Right now, TIA, we don't have any symptom except confused, but maybe patient confused because of UTI or any other symptom. Maybe she's at risk of dementia, but is not diagnosed yet. Right, so because dementia is very common in old age, like 86, and is irreversible. It cannot reverse back. So it just keep progressing. So what do you think now? TIA. Confused. But do we have another symptoms over here? Yeah, blood pressure is dropping, but I don't think so. Like any facial drop or something they mentioned up over here. No, confused all the time. If the patient is confused since surgery, so she's at high risk of fall, very high risk of fall. Patient already impaired with her ambulation and all, and now she's already confused. There are 2 factors causing she can fall because she's confused. Another thing, she's not strong to ambulate. That's why she's here for PT and OT, so she can gain her previous strength back and she can go back to home, right? So what do you think? What do you think? One or two, right? So one or two, which one? Definitely first. Okay, so we pick it up over here because patient safety is first. Confused at all time. Okay, so the third one. Good job, you're doing great. Keep going. All right. Fell yesterday. Alert oriented 3. Do we have to think yes or no? Yes or no? Definitely no. It's fine. This age, what are you expecting? Alert oriented 4? Damn. Hell no. Just move on. So, incontinent of urine. Okay. Now, we have 2 again. Think which one is important. Incontinent. Alright. Fell yesterday. Okay. Which one we have to focus? Alright, so it's saying fell yesterday and incontinent. Which one is the priority? Incontinent, we already know that patient has a history. Already she diagnosed for stress incontinence, right? So it's already in our hand. Like patient is already diagnosed. Yes, we have to work on that, like offering toileting every 2 hours. And if the patient is wet, definitely clean the patient, make the dry skin to prevent any open skin, right? But fell yesterday. So okay, if they give you option like 2 option, okay, if the patient is on fall, how many after minute interval or how often you gonna check the patient? Every 15 minutes, right? Every 15 minutes. But if it's incontinent, then how many minutes? How often? 2 hours. Every 2 hours we have to offer the bathroom to the patient. So which one we have to do more? 15. Like fell yesterday, we have to check patient every 15 minutes. So patient is already on a risk of orthostatic blood pressure drop, right? Patient already confused. That's why she's already high risk of fall and she already had a surgery, impaired ambulation, impaired body structure, right? So definitely fell yesterday. We have to go and pick fell yesterday, right? So here you go. What do you think? It's interesting, right? So in these things, in this kind of question, next generation question, they are giving us so many things to go through, but they're giving us hints also, this kind of keywords, immediate, then they're giving us 3 blanks or any highlighting stuff or something, but they're giving us 3 options too. So everything is in front of our eye. We can pick it up easily. We can answer this question easily, but the main thing, always go through the question 3 times. Always think what is in it, what they asking for that, and next pick up the key points and then try to make that image in your brain, and you can answer any kind of question. And if you have still any concern about this question, text me in my number on WhatsApp or either in our Instagram messaging system or something, wherever you prefer to do it. Just you can ask us, and we're gonna keep uploading this kind of videos to guide you how to answer the next generation questions. If you have phobia related to any care plans or something, just reach to us. We are here for you all the time, and we can help you with the this kind of questions. These are not tough one. These are just tricky, but they're giving us good hints so we can answer the question too. So here we are. So all right, so I can say thank you so much for watching this video. So keep in touch, follow our pages on Insta, on YouTube, so you can keep watching this kind of video whenever we post it. So thank you. आपका बहुत बहुत शुक्रिया ये videos देखने के लिए. Sorry, my Hindi is not good. So I'm doing my best. So thank you so much. Have a good day. Bye.